Now, gone are the days when the role of the hospital pharmacy was just to dispense medicines. At the Royal Wolverhampton Hospital's NHS Trust, the pharmacy department are leading the way in embracing state-of-the-art technologies. They're also using their pharmacists' expertise to help other hospital staff prevent, manage and resolve drug-related issues. Our reporter Charlotte Hume went to see this groundbreaking work in practice.
New Cross Hospital in Wolverhampton has experienced a dramatic rise in patient numbers.
It's pressure all the time. Pharmacy is absolutely vitally important to that, to keep the flow of patients moving through the system.
People are often brought in quite quickly. They're not expecting to come in, and they often won't have their medications with them.
The Emergency Assessment Unit has introduced dedicated pharmacists who see newly admitted patients.
Catherine, I'm going to go through your medications with you now.
They review prescribed medicines, take a full medication history if the doctor hasn't been able to.
Medicines are becoming more and more complex. Patients are older, sicker, they've got more complex problems.
They make sure doctors have full, accurate information and prescriptions are safe and appropriate.
You want to know whether their illness is related to their medication. If you're going to give them treatment, that medicine isn't going to interact badly with something they've taken.
The pharmacist looks at the clinical information. They advise doctors and nurses on prescribing and administration of medicines.
No one else really can do that. The doctors know a lot about what the drugs do, but they don't know so much about how to use them and how to take them.
So having the pharmacist on the ward is that safety net.
In this hospital, the pharmacy is no longer a room or a place. It has a presence in every ward, a pharmacy without walls, so to speak.
You create the electronic medicines management profile and it instantaneously sent down to pharmacy. So immediately it speeds things up.
Once a prescription's been clinically checked by the pharmacist, it's sent electronically to the pharmacy. This cuts down on transcription errors.
Having the whole thing more automated, my staff can spend more time on the wards so they can interact with the doctors, they can talk to patients, they can get the right medication history, and they can make sure that the patients understand their medicines before they go home.
Technology has made the process streamlined. The ward pharmacy team can relabel drugs on the ward if a new dose is prescribed. An automated dispensing machine is faster and reduces picking errors. Stock medicines are held and dispensed in an electronic storage machine, monitoring stock levels. It's secure and traceable. And a barcode scanner records every stage of the prescription process and who's responsible, right through to the scheduled delivery service. Urgent items can be sent to the wards via an air tube system.
Electronic ordering of medicines has without doubt cut our time by about 40 minutes per patient.
An aseptic unit with dedicated specialists prepares around 150 doses of chemotherapy drugs every day, reducing the risk of error.
It's a clean environment, so it eliminates the risk of infection to the patient.
In this sterile environment, pharmacy technicians and pharmacists prepare the chemotherapy. The pharmacists check critical stages using CCTV. The unit's freed up nurses to be there for patient care. And in the ward, pharmacists play an integral clinical role.
Senior pharmacists are prescribers as well as dispensers, and they do clinics alongside the consultants, monitoring and managing the toxicity of chemotherapy. So we have someone who is a specialist and expert in chemotherapy, and those are having face-to-face clinics with the patients.
The next big step is to have electronic prescribing, to actually automate everything.
As well as making the delivery of chemotherapy more efficient and the prescribing of chemotherapy more safe, it'll also help with the general governance of treatment.
All of this innovation in pharmacy has benefited the whole hospital.
It's free up pharmacists to spend more time interacting with other healthcare professionals and not interacting with machines.
That bit is a bit of quality. You're adding quality to the patient stay in hospital, and the pharmacists do that.
Pharmacists of the future have got to embrace this new technology, and they've got to know how to use it so they can make sure that their patients get the right medicine at the right dose and at the right time.